A warm good afternoon to one and all. Hope you are all doing good. I am K.S. Ramya, HOD of Psychiatry Department, working as an associate professor. Welcome to this presentation. This will be a lecture of childhood disorders. I will be attempting to cover the following topics regarding ADHD: introduction of ADHD, definition, clinical features, epidemiology, etiology, and management of ADHD. So let's start our topic, ADHD. So as you can see in this picture, the teacher is teaching, but the student was unable to concentrate. This is called as inattention. So we are going to discuss about attention deficit hyperkinetic disorder. Let's coming to the introduction. ADHD stands for attention deficit hyperactivity disorder. So in psychiatry we are having two classification. One is DSM-5 and the other is ICD-10 classification. So according to DSM-5 classification, it was diagnosed as ADHD, whereas ICD-10 classification, it was diagnosed as hyperkinetic disorder. This disorder was first described by Henry Rich in the year 1855. ADHD is known as syndrome. Why it is called syndrome, I will discuss at last. So this is about the introduction. And next, coming to the definition, it is the persistent pattern of inattention. So the child was unable to concentrate in the school or at home. And hyperactivity means they cannot sit for a long time in one place. They always want to move. For example, if they were in the classroom, they were unable to concentrate what the teacher says, and they want to move from the classroom to outside, and they cannot able to pay attention towards the teacher. And according to DSM-5, this disorder was diagnosed as neurodevelopmental disorder. And next, move on to the clinical features of ADHD. The main clinical features of ADHD were inattention, hyperactivity, and impulsivity. And these ADHD symptoms we can identify in home setting or school. So these symptoms will be presenting for at least 6 months. Continuously the symptoms should present, and because of this ADHD, it is going to affect the children. For example, social behavior means because of this inattention, they were unable to communicate with others, they were unable to maintain friendship with others, and they were unable to play with other children. And the next one is academic performance. They will get less mark in the examination, poor performance in the school, unable to complete the task in the school. So these are all coming under academic performance. And next, move on to the epidemiology. So this ADHD was mainly identified among primary school children, and the percentage is 1.7%, and it is mostly commonly seen in boys than in girls, that is 4 times. And according to ICD-10 classification, the onset of ADHD is 7 years and 12 years in DSM-5. And in this DSM-5, ADHD is about 4%, and according to ICD-10, hyperkinetic disorder is about 2%. And this ADHD was commonly seen in low socioeconomic classes, and the other one is the children who brought up in institutions. And next, moving on to the inattention in ADHD. It is mainly manifested by inability to maintain attention in any task. So the child cannot able to pay attention in doing homework or in doing any home activities. And next one is they were easily disturbed by external stimuli, and they will not listen to the school teacher or parents, and they were unable to follow the instructions which was given by the teacher or school teacher or parents. And sometimes what will happen, they will forget to do the daily activities, like they will forget to do brushing, they will forget to take bath. These are all common in ADHD children. And next one is they will be having the difficulty in organizing the activities, and sometimes they will misplace objects like books. As you can see in this picture, sometimes what the child will do, the child will forget pens, school bag, pencils at home, and goes to school. And sometimes the child will, while playing, he will misplaces the toys. And next, he will do the mistakes like unable to complete the homework. So these are all coming under inattention. And next, moving on to the hyperactivities in ADHD. It is mainly characterized by motor disturbances. The child will be having the motor disturbances. Always they want to move from one place to another place. And next one is fidgets with hands or feet. Fidget means movement. They will make some movements with hands or feet. And next one is screams in seat. Screams means it is also coming under same means. Swing means movement, moving in the seat. uh, Next one is they will leave the seat in the classroom, means they want to go out of the classroom. And feeling restlessness in this ADHD children. So always they will be moving from one place to another. Because of this excessive movement, the child feel restless. Especially this will be seen in older children. And these people will be having always uh, on to go, means they want to go out of the class. So that is called as on to go or on the go. And excessive noise, they will uh, excessive noise they will do. And next, moving on to the impulsivity in ADHD. So without thinking anything, they will do the act. And talk excessively, they will talk more. And without completing the question, they will try to give answer. And as you can see in this picture, so they were standing in the queue. So if the child who is having the ADHD, they cannot able to stand in a queue due to lack of attention and games. So for example, if the ADHD children are playing along with the other school children, uh, for example, so in the volleyball, so what will be happen, they cannot able to wait until their turn comes. Next, if other people are talking, what they will do, ADHD children, they will try to disturb the conversation. Next, coming to etiological factors, the exact etiological factors were unknown, but there are some contributory factors. First one is genetics. In the family, if anybody is having the history of ADHD, so there is a chance of getting a baby of ADHD. And next one is executive dysfunction or frontosagittal dysfunctions, means abnormal lesions in the frontal brain. It also leads to ADHD. And the third one is monoamino dysfunction, means there is an abnormal transmission of dopamine, serotonin levels, or non-epinephrine. It also leads to ADHD. And if you are doing neuroimaging test, so we can observe the decreased level of brain volumes both in white matter and gray matter. And if you take the EEG, we'll see the slow heart waves. And this disorder is commonly seen in low birth weight children, that is who is weighing 1.5 less than 1.5 kg. And this disorder is commonly seen if the mother is having the habit of smoking, during her pregnancy. And food adding agents, like for example, if you are feeding the children with fast food, it also trigger ADHD. It also triggers symptoms like ADHD. And next one is lead poisoning. Because of lead poisoning also the child will be having ADHD. And infections such as encephalitis. Encephalitis means inflammation of brain. Next, coming to the management of ADHD. So in order to rule out this ADHD, first of all we have to do the thorough assessment. Like for example, as I already told you, we have to take the family history, because if in the family, if the father is having ADHD, there may be chance of getting the ADHD baby. And next one is we have to collect their academic performance, how was the school performance. And next one is we have to take uh, we have to collect history from the mother. So whether they are listening to the mother, whether they are paying attention. So these are all things should be ruled out. And next one is by using this corners rating scale, we can able to grade the ADHD children, for example mild, whether it is mild, moderate or severe. And always we have to educate the children, parents, carers and teachers as well. And we should not blame the children for their behavior. And instead of blaming, we have to encourage, we have to mold the child behavior. And we should also give parent education regarding health diet, balanced diet, like for example nutritious diet and protein diet, because nutrition is very important for the brain development of a children. And regular exercise, we have to encourage the children to do exercise, because in the etiology we have seen the abnormal secretions of dopamine, serotonin levels and noradrenaline levels. So if you are doing a regular exercises, so what will be happening, the levels will be maintained normally. And we have to avoid foods like coloring foods, for example fast food and all, cool drinks we have to avoid. And if the child is suffering from mild to moderate ADHD, then we have to give the therapies like behavioral therapy, individual therapy and group therapy. And social skill training means for example how to play with other children, how to communicate with other children, how to maintain friendship with other children, how to share ideas. So these are all things we have to um, develop in the children. And for the severe ADHD children, what we have to do, along with the medication, we have to give this therapies. If they are not responding for the therapies, then we have to go on for medication. So coming to the medication of for ADHD, there are mainly of two types. First one is CNS stimulant drugs and the other is non-stimulant drugs. In CNS stimulant drug, we are having two important drugs, methylphenidate and amphetamines. And in non-stimulant drugs, we are having atomoxetine. So these drugs we can give orally, but methylphenidate we can also available in tablet form or patch form, as you can see in this picture. So this patch we can directly attach to our skin. So mechanism of action of these two drugs was unknown, but there are some contributory mechanism. So first one is methylphenidate. So it is a CNS stimulant. So if you are taking this drug, what will happen? It inhibits the dopamine levels and it blocks the dopamine transporter. So if it is blocking the dopamine transporter, and so that it reduces the hyperactivity in the children, and it increases the dopamine and non-adrenaline levels. So if you are increasing this dopamine and non-adrenaline levels, so what will be happening, it will it will improve motivation and reward for the children. So our brain is a set of intelligence, memory, motivation. So these are all things will be included under the control of brain. So what we have to do is we have to give this drug. And coming to the other drug, atomoxylin, that is non-stimulant drug. It mainly blocks the norepinephrine transporter and increases the norepinephrine levels, non-adrenal levels, non-epinephrine or noradrenaline levels. And next, coming to the side effects, methylphenidate. So the main important side effects are headache, reduced appetite. So the children will not feel hungry. So because of that, we have to weigh the children regularly. And the third point is insomnia, lack of sleep. Fourth point is increased blood pressure and pulse rate, so that we have to check the blood pressure and pulse rate regularly. If this dose was increased, or if the dose was given in high dose, it leads to other symptoms like psychosis, tics and seizures. So methylphenidate, as I already told you, so methylphenidate, it will be available like a patch. So if you are attaching directly to the skin, so it is causing some skin pigmentation. It is also called as chemical leukoderma. And next, coming to the side effects of atomoxylin, atomoxetine. So the side effects are similar to the methylphenidate, but not that much severe. And this person is having the suicidal thoughts. So ADHD with morbid torture syndrome means ADHD is also associated with torture syndrome. So at that time, what we have to do, we have to give the atomoxetine drug. So the person who is having the torture syndrome, we have to give this drug, atomoxetine. So this both drug, atomoxetine and methylphenidate, can cause a symptoms like preapsia, which is seen in males. So preapsia means it is a painful penile erection. So because of this painful penile erection, it is going to damage the penis. Next, coming to the long-term course of ADHD. So this ADHD will start at childhood, and as the child gets older, the symptoms are going to get severe. And because of this ADHD, it is going to affect the educational levels. Example, they cannot get good marks in the examination, they cannot get good percentage. And next one is occupational status. So they are having the job difficulties, they cannot able to get the proper job. And if the ADHD was untreated, so the outcome will be very poor. And we have to give medication and psychosocial skills as well. And next, so this ADHD symptoms, what will be happening, it will be present from childhood, and it will be also lasting up to adulthood. So this ADHD disorder, if the children is having the ADHD disorder, it is also going to affect the children. For example, the children also will get conduct disorder. And the other disorder is like substance abuse or substance misuse disorder, like taking excess amount of alcohol, barbiturates, cocaine. So these all coming under substance use disorder. And next, antisocial behavior. So antisocial means they will behave against the society, like for example criminal behavior. So these are all coming under antisocial personality. Thank you for watching. Hope you all understood this topic. Thank you.